Hello, welcome to Phoenix. We are here at the annual meeting of AHRA, the Association for Medical Imaging Management. My name is Brian Casey, Editor-in-Chief of AmpMini.com, and we are here with Rebecca Farrington. She is Chief Revenue Officer of Healthcare Administrative Partners. Rebecca, thanks for being with us today.
Thanks for having me. We're super excited. First-time attendees and first-time exhibitors at AHRA this year. So excited to be back and out, and looking forward to the week.
Yeah, it's a great show here at Phoenix. So you guys have been, we're on the second day of the show, you guys have been here for a little bit and walking around. Anything in particular that you've seen that really kind of got you excited?
Yeah, I mean, it's great to see so many people out, great participation, attendees as well as exhibitors, and lots of buzz around some regulatory stuff going on, lots of buzz around some announcements from last week specifically.
Yeah, so last week CMS, which runs Medicare and Medicaid, announced it has a new Medicare physician fee schedule, and there are some changes in there.
There are. So we had kind of two meaningful announcements last week. The CMS came out and talked about indefinitely delaying AUC CDS, and so we were a little bit surprised to see that. In most cases,
and that's using the appropriate use criteria to
yes.
order to clinical decision support to order exams.
Exactly, and so there was typically a penalty that would be associated, and so at the end of every calendar year, the last few years we would see that penalty delayed for the next calendar year. They came out last week, so a little earlier than we would anticipate in the calendar year, and said that penalty associated is delayed indefinitely.
And so this was supposed to go into effect in January of 2023,
That's right?
right? And so
That's right.
Everybody, I mean, this is a pretty radical change in how imaging exams are ordered, because previously, the referring physician would just say, well, I want a chest CT, but now they're going to have to go through, they were supposed to go through some sort of clinical decision support software that would maybe reduce inappropriate utilization.
That's right.
And it seems like CMS is just kind of kicking that can down the road.
They are, and for the first time, they've kind of kicked it down indefinitely. So what we had seen is kicking it down for a year at a time. And obviously, it's a massive stress on the organizations, but obviously the intention was to kind of manage what that criteria is, so you're managing kind of healthcare spend. So I think the significant thing last week is that's not only kicked down the road for a year, but they kind of delayed it indefinitely, the penalties associated with that. So that was significant.
Do you think there's a chance that they're just never going to implement this at all?
I do, yeah. I think that it's incredibly cumbersome to implement. I think that, based on some of the expenses and reductions in revenue from the last couple of years, it's obviously a financial burden to implement it. So I think that, most of us are feeling like there's a possibility this may not happen. But what they're saying by their announcement last week is that if it does, it's not going to happen anytime soon.
Okay. Now, there were also some reimbursement changes. It sounds like radiology got a little bit of a haircut in there.
A little bit. So the MPFS proposed rule for 2023 came out last week. And so we're looking at about a 4% reduction in the conversion rate. The majority of that is coming from the expiration of that boost that we got in 2021 for 2022. So about a 4% cut in the conversion factor. And then we're looking in general, it seems to be about a 3% cut across the board for reimbursement, 4% for IR, and about 3% for nuke med. Now the ACR came out, and through their kind of evaluation and analysis, they're looking more at about a 6% cut, assuming that it's going to be about a 7% for IR, 6% for nuke med. So we're thinking we're somewhere in between 3 and 6%. As you know, when we went into 2022, our worst case scenario was 11%, and we settled in at around 4%. So we're thinking that those kind of reimbursement cuts generally across the board should probably for 2023 settle in around where we ended up in 2022.
Okay, well, we'll have to stay tuned and see where that goes. Now, the other thing that you've also been following really closely over the last few years are the different programs related to the public health emergency caused by COVID.
That's right.
And so some of those are some of those drawing to a close now?
They are, and so interestingly, some of them are drawing to a close, but Also, some of the programs that we are seeing changes are for the first time not attached to the public health emergency. For example, AUC CDS. So when they talked about delaying it, they didn't attach that as anything, as part of any other kind of program that's going on. So we're starting to see some of the funding for that dry up. And then we're also watching for what happens for PAYGO. Nothing definite now, but obviously that has a potential impact as well as they go into 2023. So that is basically a cut that you could see based on performance. And so, and then also we're looking at MIPS. We did have a quality measure top out in 2022, measure number 76, so that will expire in 2023. So we're seeing a little bit of a reduction in some of the quality measures associated with MIPS.
Okay. Well, sounds like you guys have a lot to follow.
We do. Lots of stuff going on.
Awesome. Well, thanks so much for being with us. It's great to see you again.
Thank you.